Greetings, everyone. It's Friday, November the 20th. We've had a few really cold fall days, and I think we're headed for some pretty good weather coming up. It's been a strange year in terms of weather. We've got hurricanes out there. We've run through all of our names in our hurricane list, and now we're down to names like iota. So it's been a strange year, but of course it's 2020. A few things to really update y'all on. By the time you get this, you probably will have gotten emails from Tracy Thigpen around our rapid testing. I mentioned this that rapid testing was on its way with CARE South Carolina. Indeed, it is here. Our equipment finally came in, and our testing kits finally came in. We are going to roll it out for employees first. As Tracy said in her email, Tracy will continue to be the gatekeeper, so to speak, of what your steps should be should you desire a rapid test or should you need a rapid test, as you would need one if you had symptoms over the past 5 to 7 days. So let her work these guidelines out with you. Let her be sort of our gatekeeper on that. It's not an easy thing, the complexities of using the rapid test and so forth. So we think that this will work out pretty well. After the holidays, look for us to be able to announce how we will be rolling this out so that more people in our community can take advantage of this very good opportunity. Rapid testing is going to really start ramping up now, not just in medical offices. I think the governor announced today that rapid testing was soon to be rolled out in the school settings. Nursing home settings have been doing rapid testing for a while now, so I think we're going to see more and more of this. It doesn't mean that we're going to stop doing our drive through with what's called the PCR testing. Indeed, we're probably going to be able to continue that. We don't see any reason at this point. But for our rapid testing, we will have a bit of a different procedure. And we've still got to work through some of those uh, decision trees and pathways and how we're going to do things and so forth. So it'll be really after the Thanksgiving holiday that we can roll out and get all those processes together. So look forward to that. But again, the rapid testing is available to you as an employee. Okay, moving away from that. I know by now that you all have been subject to or have learned about the enhanced screening that we're asking you to do as you come to work. Uh, I know that you're thinking, well, it just is a waste of time. It's taking all my time, and I just need to get in and go to work. Well, we have been screening patients now and doing those still three things, for instance, doing a temperature check, asking the patient if they have any symptoms, and then asking them if they have any reason to believe that they have been exposed or in close contact with someone who is positive. So, if we would ask those questions, those screening questions of our patients, why wouldn't we do the same thing for our employees? And really and truly, as we watch the huge increase in active cases across our service area and across our state and across our nation, it became pretty apparent to us that we really need to get very serious and make sure that our work environment is as safe for our employees as it is for our patients. So bear with us. Understand that we are not the screening police, though. If you're going to lie about it, there's nothing we can do to stop you. But that really is a terrible thing because if you don't tell the truth about whether you've got symptoms or whether you've been exposed to someone, you could directly be responsible for either a hospitalization, a serious illness, or worse, a death. Do you really want to take that chance? Be honest. If you have symptoms, now we have the ability to test. If you've had an exposure, understand that without your honesty, lives are at risk. People are dying. This virus has not gone away. I could not sleep with myself at night if I had thought, well, let me think now. I wasn't with my, oh, I don't know, grandson, but for a little while, and even though he's positive and pretty sick, I don't I don't think I'm really going to be infected. And then go into work. And sure enough, even though I didn't get symptoms or anything, someone else did, and they got very sick. And they may have even infected someone who got even sicker or maybe even died. Don't make those decisions. Be honest and be forthright. It's not just your life at stake, it's many, many others. So we can't be the police, but we can expect you to make the right decision and do the right thing and be honest in your screening. Please do so. We've got months ahead of us, perhaps, and we need everyone to be in this together and to take responsibility. You may be hearing about vaccines. There is some good news in all of this. When was it? I can't quite remember, but the first people to come out and say, oh, we got a vaccine was Pfizer. Pfizer did so, and then everybody started looking at the small print. And Pfizer said, yes, but our vaccine has to be stored and managed at ultra cold temperatures. Everybody originally thought, I remember reading that and thinking, well, that just means it has to be frozen. It's got to be frozen all right, but it's got to be frozen at something like minus 90 or 70 or something degrees Fahrenheit. That is what ultra cold is. So that's nobody has freezers like that, not even hospitals. That's a chemistry labs type of freezer. So that became a real issue. They said, well, we may have a vaccine, but nobody can use it. Nobody can deploy people to give anybody the vaccine. Pfizer actually said they were going to go back to the drawing board and perhaps see if they could retool their vaccine somewhat. Go ahead and release it because there are some storage facilities with that capacity. But then right on the heels this week, Moderna released their vaccine, and their vaccine has the ability to be stored at room temperature for a short period of time. That's really good news. Um, in that same context, we have signed a vaccine agreement with the Department of Health. What this means is that we are going to be partnering with the Department of Health when the deployment for whichever vaccine becomes available for us to be able to manage. We will be an entity who will be providing the vaccinations. There is a South Carolina Vaccine Task Force under Department of Health. They are going to be determining the priorities, who should get the vaccine and in what order, and how are we going to distribute it and deploy it and so forth. I don't have all of those answers. There hasn't actually been a conclusion yet on some of that. What we have been hearing is that healthcare facilities really might be those who are at the front lines, will be first in line. But we've got to wait and see how that becomes finalized with our Department of Health. But know that we are formally in partnership with the Department of Health as a vaccine partner. And we'll be sharing much more information when it becomes available. And hopefully, we'll be able to deploy vaccines that'll get some of this coronavirus under control. And does need to get under control. I mentioned earlier, local cases have been steadily climbing. I think y'all are tired of hearing me talk about the surge, the surge, the surge, but the surge. And we're seeing it. We've seen it already across the nations. We've had higher cases than ever, more deaths than ever, and in our own service area, as we watch the active cases increase. We look at hospitalizations. Frankly, the hospitals over in Florence County and Marion County are full. They're at capacity. We've got some capacity in our hospitals in Dillon and Chesterfield and Darlington counties, but how long is that going to last as more and more people get sick? And as I said in my last video message, that opportunity for sickness is rapidly increasing because there's a Thanksgiving holiday coming up. And I know that people really want to get together with families. They haven't seen some of their family members in over 6 months. But I think the decision that really comes down to is seeing them now. And I actually saw this as a meme on Facebook. Would you rather see them now or see them later after Christmas in the funeral home? And that's a tough nut to swallow. What difficult decisions we're being faced with, and I know. But we have to face these choices and these decisions. And we have to buckle up and realize that the wrong decision could put somebody in the hospital or even worse. The surge is coming and it is here. All right, got a couple of other things going on. It's not only about COVID, although it does seem that sometimes many of us at work feel like all we do is COVID every day, all day. But there is a big project underway at CareSouth, and that is the implementation of the new EHR. Training will begin after Thanksgiving. Our new EHR called eClinical Works, or ECW. I think everybody's going to be really, really excited and pleased with it. It's a darn good EHR. It's going to be much more nimble and flexible and frankly, I think easy to use. The problem is we're doing this during a pandemic. That means all of our training has to be virtual. That is hard to do virtual training. And I know it's going to be really tough. Uh, it's so much easier to be able to do it in person. Not just easier, but you really learn better when you have an in-person trainer. But we don't have that. We are going to be doing training virtually. There's big plans in place. Staff have been working very, very, very hard to get you not only equipment but space and the opportunity to do training without too much of a disruption to direct patient care. It's been quite a task bringing all of this together. But training is going to start, and then the big day, December the 14th, we will be going live with this new EHR. You know, it's actually not a bad time to go live because things actually slow down over the Christmas holidays. People don't want to go to the doctor's office, and many of us go on vacation. So it's not a bad time to be able to switch to a new EHR. Things will be a little bit slower. It still won't be easy, and I know that and I understand that, but we will get through it. We've made sure that part of our contract with our implementation and our consultants, who are called Blue Novo, we've made sure that we've actually contracted for extra time, extra training, extra resources, because we know that's going to be hard on y'all and it's going to be a difficult time. So the more support and the more training we can provide, the smoother it'll go. So let's buckle up. We've got a new EHR on the way. My last little bit of news is also good news. The Chesterfield building, it is virtually complete. We did what's called a punch list walkthrough earlier this week, and there were still things that the contractors needed to accomplish, some paint touch ups and other things. So the contractors probably won't be completely finished for 2 or 3 more weeks. And frankly, we haven't gotten the HRSA approval yet. So, we're still kind of in a holding pattern, but we've made extraordinarily good progress on it. The building looks fabulous. It's going to be very special, and the Chesterfield people are, I know, going to be joyous to be able to come out of an old building whose walls and roof are falling down around their heads. So let's help them celebrate this. And I hope to be able to share a walkthrough at some point as a video, either and post it on Facebook or provide it in an email or something. We'll see if we can accomplish that. Folks, I won't talk to you next week. Next week is the Thanksgiving holiday. And we, of course, are closed Thursday and Friday, but I'm also taking a few leave days, Monday, Tuesday, and Wednesday. Everybody needs to have a little break. We all need that. So please have safe holidays. Please make good decisions. But most of all, take a break. Um, Relax. Enjoy. I'm actually looking forward to some pumpkin pie. Bye bye, everyone.